Good day, everyone. Today, my group is going to present regarding the red blood cell abnormalities, specifically kodocyte. My name is Tashranjit Kaur.
I'm Ramya.
And I'm Tan.
The contents of these slides includes the introduction of abnormal red blood cells, introduction to kodocytes and their morphology, etiology, pathogenesis, sign and symptoms, diagnosis and complication, as well as the treatment and prevention. We will start off with the introduction to red blood cells abnormalities. Normal red blood cells are in the shape of a disc, thicker on the edge and thinner in the middle, or also known as the biconcave shape. The term poikilocytosis refers to a condition where 10% or more of the red blood cells are abnormally shaped due to other medical conditions. These cells may have point-like projections or may include shapes that are flat, elongated, teardrop, or in the shape of a sickle cell or crescent cell. Symptoms of poikilocytosis depends on the root medical condition. They often include signs that the body's tissues are not getting enough oxygen delivered by the red blood cells, such as chronic fatigue, weakness, pale complexion, difficulty breathing, as well as heart palpitations. However, these same symptoms could point to chronic inflammation, so the doctor will need to perform a blood test. Next, we'll move on to the introduction to the kodocytes, the morphology. Kodocytes are also known as target cells. They are red blood cells that have the appearance of a shooting target with a bull's eye. Red blood cells have a dark ring surrounded with a white ring, followed by another dark ring, dark center, giving it a bull's eye or target-like appearance. These cells usually indicates that there is an excess of cell membrane relative to cell volume. The etiology. So, what is the cause of kodocyte? This is also described as a relative membrane excess. It is due to their increased red cell surface area or increase beyond normal, or else a decrease intracellular hemoglobin content, which may cause an abnormal decrease in cell volume without affecting the amount of membrane area. Some of the etiology includes the lack of sufficient nutrients, underlying diseases such as liver disease or cancer, thalassemia, recent splenectomy, iron deficiency disorder, as well as genetic mutation in DNA.
Okay, now I would like to present about the pathogenesis. Any abnormal shape of RBC called poikilocytes. So poikilocytosis is typically the result of another condition. Poikilocytosis conditions can be inherited or acquired. So inherited conditions are caused by a genetic mutation and acquired conditions develop later in the life. So inherited cause of poikilocytosis include sickle cell anemia, which is a genetic disease characterized by RBC with an abnormal crescent shape. And then thalassemia, which is a genetic blood disorder in which the body makes abnormal hemoglobin, pyruvate kinase deficiency, McDougall syndrome, a rare genetic disorder that affects the nerve, heart, blood, and brain. And also the symptoms usually come on slowly at begin in mid adulthood, and then hereditary alipotocytosis and hereditary spherocytosis. And acquired causes of poikilocytosis include iron deficiency anemia, which is the most common form of anemia that occurs when the body doesn't have enough iron. And then the megaloblastic anemia, which is an anemia typically caused by a deficiency in folate or vitamin B12. The third one is autoimmune hemolytic anemia, a group of disorder that occurs when the immune system mistakenly destroys the RBC. And then liver and kidney disease, alcoholism or alcohol-related liver disease, lead poisoning, chemotherapy treatment, severe infection, cancer, and also myelofibrosis. Okay, so the sign and symptoms, the main symptoms of poikilocytosis is having a significant amount, which is greater than 10% of abnormal shape RBC. In general, the symptoms of poikilocytosis depends on the underlying condition, and poikilocytosis can also be considered symptoms of many other disorders. So the common symptoms of other blood-related disorders such as anemia includes weakness or fatigue, shortness of breath, uh, fast or irregular heartbeat, occasional losing sound in the ear, and then headache, dizziness, pale skin, and chest pain. Next, let's move on to the diagnosis. So, a healthcare provider can perform a peripheral blood smear (PBS) to diagnose poikilocytosis. So, during this test, a lab technologist look at the blood smear underneath a microscope. Then, they will be able to tell how many oddly shaped cells the patients have and what kinds, and then the providers commonly order a PBS along with a complete blood count. So CBC is a test that gathers information about the patient's blood cells, including the levels and size. So certain value of CBC can provide additional information about the patient's red blood cells that helps the provider diagnose what causing poikilocytosis, including the mean corpuscular volume, which is the average size of the RBC, and then mean corpuscular or hemoglobin, the average amount of hemoglobin in the RBC, and then mean corpuscular hemoglobin concentration, which is the average amount of hemoglobin concentration in the RBC, and also the red cell distribution white, which means how many different sizes in the RBCs are. So the providers may also check the patient's vitamin B12, folate, and iron levels, and they may perform liver function tests, among others.
So now for complications of chorocytes. For most of the complication, it is fairly reversible, but for long periods without treatment, it can lead to organ failure because there is a decreased amount of oxygen being supplied to the tissues and also the organs in the body. So there's always a treatment for it, which is to change your diets to include more of the iron, vitamin B12, and also folate into your daily intake as well. Another treatment that you can take is to carefully monitor any emerging conditions that you might have from the symptoms just now. So another treatment that is possible is to uh, receive blood transfusion, but only be done as a last resort. That blood transfusion is the last resort for treatment. But before treatment, we must be able to prevent uh, these chorocytes. But it is worth noting that inherited conditions you cannot prevent because it is encoded in your DNA. So the acquired conditions we can prevent by having a high nutrition diet, especially high in iron, vitamin B12, and also folate, as they are the key nutrients for producing the hemoglobin and also the red blood cells. Uh, another prevention is to reduce your consumption of alcohol because alcohol will uh, will hinder your body's capability to create more hemoglobin and also red blood cells. So So that is it from our group. Thank you.